What is chronic fatigue syndrome and its treatment? Chronic fatigue syndrome is a type of psychosomatic or psychosomatic disorder that causes problems in your daily activities. The symptoms of this disorder are usually characterized by severe fatigue, which rest does not improve and has existed for at least 6 months. Many factors can be involved in the development of this syndrome. Various pharmacological and non-pharmacological treatments have been proposed for chronic fatigue syndrome, which have been successful in improving the symptoms. What is chronic fatigue syndrome? Myalgic encephalomyelitis or chronic fatigue syndrome, ME/CFS, is a debilitating condition defined by severe fatigue for no apparent reason. The difference between chronic fatigue syndrome and normal fatigue is that chronic fatigue syndrome does not improve with rest. This fatigue makes it difficult for you to perform normal daily activities. Chronic fatigue syndrome may be accompanied by problems with memory, concentration, muscle, and joint pain, and the symptoms usually worsen with physical or mental activity. Chronic fatigue syndrome can occur suddenly and for no reason and last for years. What is the cause of chronic fatigue syndrome? The cause of chronic fatigue syndrome has not yet been fully determined. It is possible that more than one factor such as genes, immune system decline, environmental factors, and infections are involved in the development of this syndrome. However, recently an article has been published about the possible causes of this disorder. According to this article, there are many theories about the etiology of this disorder. The most probable causes of chronic fatigue syndrome include the following. Genetics. Much evidence supports the role of genetic susceptibility in patients with chronic fatigue syndrome. Many studies have reported the role of family history in the development of chronic fatigue syndrome or fatigue-like symptoms. Infection. Some infections, such as those caused by Epstein-Barr virus, EBV, human herpes virus, HHV-6, and human parvovirus B19, may cause this disease. Impaired immune system function. There is evidence that abnormalities in the immune system may play a role in the development of chronic fatigue disorder. Environmental factors. Exposure to certain environmental toxins or stressors have been investigated as possible causes of chronic fatigue. Although the exact cause of this syndrome is not known, people have reported that they have experienced the symptoms of chronic fatigue syndrome, usually after one of the following conditions. A disease with symptoms similar to the flu or a cold. Stomach infection or similar infections. Severe physical injuries such as surgery. People with chronic fatigue syndrome may sometimes have hormonal problems. Vitamin deficiency can also be a cause of chronic fatigue syndrome. Vitamins such as B2, riboflavin, or B12. We still do not know for sure whether taking these vitamins will necessarily improve symptoms or not. Chronic fatigue syndrome is more common among people aged 40 and 50. Gender also plays an important role, because women are 2 to 4 times more likely to suffer from chronic fatigue disorder than men. What are the symptoms of chronic fatigue syndrome? The symptoms of chronic fatigue syndrome can be different in different people. The most important symptom is chronic fatigue with an intensity that causes disruption and difficulty in your normal daily activities. Chronic fatigue syndrome is associated with the following symptoms. Sleep disorders such as chronic insomnia, not feeling refreshed after a night's sleep, and other sleep disorders. Feeling of poor memory. Low concentration. Muscle pain that is not caused by physical injury. Unexplained extreme fatigue. Although the mentioned symptoms are more common, the American Myalgic Encephalomyelitis and Chronic Fatigue Syndrome Association, AMS, reports symptoms for this syndrome that, although less common, are seen in some people. Making mistakes in saying words. Pain in the chest. Difficulty feeling when walking. Anxiety and panic attacks. Nocturnal muscle spasms. Numbness or tingling in hands, feet, and face. Decreased libido. Chronic fatigue syndrome can also be periodic. So that at one time you feel better and at another time you feel that all the symptoms have worsened. There may even be periods when you experience no symptoms and feel cured. These symptom-free periods are called recovery periods. Consider that symptoms may return after periods of recovery and complicate the situation. Finally, it is important to find the right treatment process for you and continue it until complete recovery in order to avoid the problems of this syndrome. What is disability after activity? If you have chronic fatigue syndrome, after performing physical or mental activity, you will experience a condition known as post-exertional malaise, PEM. If you experience it, you may experience the following symptoms after performing an activity. You will: hardening of thinking, sleep disorder, sore throat, headache, dizziness, feeling exhausted. After an event that causes post-activity fatigue, it may seem difficult or impossible to leave the house or even get out of bed and do normal activities for a few days or even a week. The symptoms start from 12 to 48 hours after performing the activity and become more severe with the passage of time. How is chronic fatigue syndrome diagnosed? The symptoms of chronic fatigue syndrome are very different and can resemble the symptoms of other diseases, which makes diagnosis somewhat difficult. For an accurate and definitive diagnosis, preferably see a psychologist or psychiatrist. These specialists perform a complete and accurate assessment of your symptoms. It is better to do medical tests as well because although there is no test to diagnose chronic fatigue syndrome, testing helps to have a more accurate evaluation by eliminating the possibility of other diseases. Your doctor needs to make sure your symptoms aren't caused by another condition and take your medical history into account in this evaluation. According to the WHO, there is currently no consensus among medical professionals on how to definitively diagnose chronic fatigue syndrome. Chronic fatigue syndrome is more than just feeling tired. More symptoms come with it that make your life difficult. This syndrome makes doing simple activities such as writing an article or walking a few steps challenging. Sleep and rest do not help to improve this condition. Before treating and solving this syndrome, it must be diagnosed. The main diagnostic symptoms for the diagnosis of chronic fatigue syndrome are reduced ability to perform normal daily activities for 6 months or longer, worsening of symptoms after engaging in physical or mental activity, and difficulty falling asleep or staying awake. Discontinuous sleep is diagnosis of chronic fatigue syndrome. According to the Johns Hopkins Medical Journal, the symptoms of chronic fatigue syndrome can be similar to those of the flu. Although each person may experience different and unique symptoms, the most common diagnostic symptoms of this disorder include the following: sensitivity to light, headache, extreme fatigue and weakness, muscle and joint pain, insomnia or insomnia, weakness and concentration, forgetfulness, emotional and mood swings, depression, feeling confused, emotional irritability, irregular heartbeat, pain in the eye area. To diagnose chronic fatigue syndrome, you should consider the following: severity and duration, severe and chronic fatigue that has lasted for more than 6 months and you have not found another and more probable reason for it. Number of symptoms, you see at least 4 of the symptoms mentioned in the previous section. Experience at least one of the following: impaired thinking and memory, or symptoms that worsen with standing or standing up suddenly, such as lightheadedness, dizziness,